Hey guys, I wanted to come on here today and talk to you a little bit about insulin resistance and heart health. So for many years, cardiovascular disease has been the cause of death, the leading cause of death worldwide. And cardiovascular disease is associated with many other factors, including obesity, abnormal cholesterol, triglyceride values, and also insulin resistance. So insulin is a hormone that allows our body to absorb glucose, which is a component of sugar that our body digests when we eat fruits, vegetables, grains and starches, dairy, beans and legumes, and sugars and sweets. So insulin resistance occurs when there is a decrease in the body's ability to respond to insulin, and therefore it results in reduced uptake of glucose into the cells in the body. Insulin resistance also limits glycogen synthesis, which is energy that's stored in the liver, and the body's ability to break down fatty tissue. So how does it affect our heart health? So it affects our heart health in 5 ways. Firstly, there's an imbalance in glucose metabolism, and that causes chronic high blood sugar, which is called hyperglycemia. And this hyperglycemia prompts oxidative stress and inflammation that leads to cell damage. Secondly, altered lipids metabolism, which leads to dyslipidemia, and that's where you get the high cholesterol and high triglyceride levels, and also lowered good HDL cholesterol levels. Thirdly, endothelial dysfunction. That's where we get damage in the blood vessel walls, which increases plaque buildup in the veins and arteries. That's called atherosclerosis. And those are significantly associated, or that is significantly associated with heart attack and stroke. Fourthly, individuals with insulin resistance have increased blood clotting, called hypercoagulability, and reduced fibrinolysis, which is the ability to break down blood clots. And those can contribute to heart attack and stroke. And fifthly, research shows that 30% of people with hypertension or high blood pressure have insulin resistance. Research shows that avoiding insulin resistance could prevent approximately 42% of myocardial infarctions. So, one of the main ways to reduce insulin resistance is by losing extra body fat if you have any. And you can reduce your insulin resistance by eating well-balanced meals, by limiting refined carbohydrates, and by being regularly physical activity. If you would like to learn more about reducing and preventing insulin resistance and improving your heart health and reducing your risk of heart attack and stroke, you can do that by working with me. I encourage you to click on the link to book a free empowerment call with me to see how we might be a good fit to work together. Have a great day, and we'll talk to you soon.